All right. Hello, this is Dr. Lena Edwards, and I'm interviewing Anne-Marie today. Anne-Marie has a very interesting hormone story that I thought would be very educational and informative for everybody who watches this and listens to her story. So Anne-Marie, can you just start out by just giving us very general, a little brief overview of your medical background so we know sort of how you ended up where you were and are now?
Well, I'm 48 years old, and I've been diagnosed with hypothyroidism, Hashimoto's, since '97. So I've been on and off different thyroid medications. I've been on and off different antidepressants, anxiety medications. And of course, as I've had a hysterectomy, still have my ovaries. So I do have that challenge also. But that's kind of my background. And so.
Okay, perfect. So that gives us an idea from place to start from. So we're not going to mention the name of the place where you went, but you went to a clinic, which is sort of like well, they have multiple locations around the country. I know for sure around the state where you live, which I also won't mention. And so tell us why you went to that place.
Well, I'd seen obviously commercials, and when you're not feeling at the optimum level, then of course you're always searching for something that's a miracle cure to make you feel better. So I went there thinking, okay, I'm getting older. Might having some hormone issues at this point, so I figured I'd go there. They advertise, free consultation. They'll blood work and do that for you and analyze everything. And I was having weight gain, loss of libido, and just tired quite a bit, not feeling that. Even though I was 48, I was feeling 60. So I figured I would give it a shot.
Okay, perfect. So tell me a little bit about your visit with them. How did they evaluate you, and what did they do to sort of determine what it was that you needed?
Well, we did blood testing, and that's what they did. They did a panel of basically your hormones and tested for DHEA, testosterone, estrogen, cortisol, testing to see whether I was in menopause or perimenopausal, all blood work.
Okay, all right. Did they do any other kinds of testing on you, or ask you about other factors that might affect hormones? Like, what was their evaluation?
Not necessarily. It was more just a general questionnaire of how I was feeling, and obviously my medical background. But
okay, all right. So did they talk with you at all, other than the questions on the questionnaire? Did they discuss things with you like exercise or sleep or diet or, genetic background potentially, or anything like that?
Not really in detail. I mean, they did ask me like if I got my yearly visits, programs, those kinds of things, but not really exercise or anything like that. No.
Okay. All right. And when you went to this place, what type of provider did you see?
Nurse practitioner.
Okay. At any point, how many times were you evaluated there? Or how many times did you have the visits there, I guess?
I visited with them one time and then went back the next time for the blood work. Came back one more time for the results. And that's when signed up for the program. And then visited, and then they prescribed the medication, of course. And then I went back probably 3 more times after that, just for general, how you doing, how you feeling kind of things. But most of it was done via phone, to tell you the truth. Okay.
All right. And how did they, how were you feeling with what they put you on? I guess they determined you needed X, Y, or Z hormone. And I guess you don't have to give specifics as far as dosing and that kind of thing goes, but based on, I guess, your blood testing, really, is that how they decided what to put you on and how much?
Yes, they decided that I needed to be put on testosterone, so they put me on a testosterone cream. Also said I was low on DHEA and provided a supplement for that.
Okay.
After that, I really did not feel any different. They acted like it was going to be a miraculous change that I was going to feel, and I did not. I actually started having acne. So then they prescribed more medication in order to offset the acne.
Okay. So you started the hormone regimen that they gave you. You went back to them on what sounds like a fairly regular basis. You weren't feeling any better. you started having some side effects from the replacement, and then they just added other prescription medicines to counteract the effects of what they gave you.
Correct.
Is that correct? I just want to make sure I understand this correctly. Okay.
Absolutely.
All right. All right. So, so what happened after that when they were giving you medications? And I assume that you're no longer going to this place. Okay. So give us a general idea of what happened after what you just told me. You went back, things weren't getting better. They put you on a couple of more prescription drugs. And then what happened?
Well, they also indicated in the blood testing that my thyroid wasn't at optimum levels either. So I went back to my endocrinologist. He increased my dosage of my thyroid medications. Then told me to come back in 6 to 8 weeks, get more blood testing. And he was actually going to test my testosterone.
Okay.
He actually ran the blood test for the testosterone and the DHEA after that 8-week period of being on the higher thyroid medications, and discovered that it was quite high. Even under this facility's standard, I did the comparable comparisons, and I was pretty much at what they considered optimum level, even though I wasn't feeling any better at all, plus taking 3 more medications. So at that point, my endocrinologist recommended that I stop the therapy, and so then I contacted them, and we went from there.
Okay. So you don't have your uterus, but you still have your ovaries, which means you're not bleeding, but how did they determine whether or not you're still ovulating?
They just said that I wasn't menopausal or perimenopausal according to the blood work that they did. That's all I was told.
I see. Okay. All right. And so you've been off of everything that they gave you for how long now?
About 3 to 4 weeks.
3 to 4 weeks. Okay. So are there any changes that you've noticed since you've come off of what they gave you?
I feel better. I guess, my thyroid medicine's better now. So maybe that's probably the main factor of feeling better, I would think.
Did they ever, because you're only 48, and just for the purpose of education, when a young woman, or any woman for that matter, has low testosterone, if you think about it, so half of the testosterone comes from ovaries, the other half comes from adrenal gland production. So I'm always curious when women go in and they have testosterone levels measured and they're told that their testosterone is low, did they ever try to determine why your levels were low, or did they just give you testosterone because your numbers were low?
Just gave me testosterone because my numbers were low.
Okay. And so the reason I wanted to point that out as a teaching point is because if you don't figure out why a woman's testosterone levels are low, then just giving them testosterone might actually, well, first of all, it's probably not going to be very helpful, or it can actually make them worse. The other thing I wanted to let you know, and I know you already know this, is when you're using a cream, you can't do blood work, because blood work is always going to underestimate the amount of hormone that you're getting. And there's a physiological reason for why that happens. But the only time that when women are using a cream of any kind, whether it's testosterone or any other kind of hormone cream, the only time you're ever going to see it in the blood is if you're getting overdosed. So when you're using hormone creams, you cannot do blood work and get reliable results. And that's probably why you started having side effects with acne. And over time, the side effects of testosterone can become even more substantial than that. So it's good that you cut back. Incidentally, question, with the medication that they gave you, did the acne go away?
Actually, it did.
It did? Okay. Did they ever try to lower the dose of the testosterone?
No, they increased it.
They increased it. Okay. So the other counterintuitive point is that the medications that they gave you actually prevent testosterone from working. And so it just makes no sense, I guess, to give medications that are going to counteract the action of the hormone that they're actually trying to get to work. But anyway, so, okay. Well, I guess given your experience and what you've had happen with you, what kind of advice would you give to women who are trying, especially because there's so much misinformation and so much miscommunication with respect to hormones and hormone replacement therapy, and there's all kinds of people out there that are just sort of hanging up their shingle and saying, I do hormones, come see me. What kind of advice can you give people women to help sort of direct them if they are either on hormones and not doing well, or are interested in maybe pursuing hormone replacement, but they're afraid because of the very reasons I just mentioned?
Well, advice. Seek out the person that you're getting the advice from and educate yourself on their experience and their background. That was one of my biggest fears, obviously. And if someone says, okay, this is a miracle and this is going to make you feel like you're, 30 and when you're 48, then it's probably too good to be true.
Mm-hmm.
And there is a reason why the things go on in your body that you probably need to dig in a little deeper than just them saying, okay, here, this medication's a miracle and it's going to fix everything for you.
Mm-hmm. That's really good advice. That's really, really good advice. Well, Anne-Marie, thank you so much for sharing your experience with us. I really do appreciate it. And I'm sure everybody that's watching this will also appreciate it. Probably will generate a lot more questions, but that's what the discussion's all about. So thank you again.
Glad to help.
Thank you.